Good morning. My name is Noemi Perez, and I'm doing a video validation on how to set up a central line. Once I check the doctor's order, I introduce myself to the patient. I ask for two forms of ID. I ask for name and date of birth, and I verify those with patient's bracelets. I then explain the procedure to the patient, and I go ahead, wash my hands, and I provide some privacy for my patient, and I gather my equipment. The first thing I want to do is I want to put the bed at a working position. I then want to open up this. I make sure that it is not expired. I take it out. I then dispose of it. And then I remove my mask and sterile gloves. And I just, there should be two masks there, one for the patient and one for yourself. If the patient doesn't want to wear a mask, you can ask the patient to move the head away from the site, and you just put on your mask. Okay, and then you could also put the side rails down so it could be easier for you to work with. At this point, you could put on clean gloves. And then you're just going to expose the site, and you're going to expose the patient and site, and you're going to remove the old dressing off. Guess I could put the bed a little bit higher. See? Okay. All right. Once you have, you could take off the dressing. Just hold down the tubes so that nothing comes off, and just pull the tape gently as possible. Sometimes it gets sticky, and just pull towards the dressing. And then just pull it down. And once you do that, you could then remove your gloves at this point and dispose of them. And then you could go ahead and then start by opening your sterile field. Make sure you open away from yourself. Okay. At this point, you could open up your sterile gloves. Put on your sterile gloves. You start with your dominant hand first. If this happens, you could fix just your hands. Okay, once you do that, you could, if there's alcohol swabs on your sterile field, you could take the alcohol swabs and just hold the tubes with this hand. This hand is going to maintain sterile. This one is not. You're going to hold the tubes and just clean any dry blood or anything or any debris from the site. And then you could just dispose of the swabs. Then you could take your chlorophyll and then you're going to crack it. You're going to hear a click sound. And once you hear it, you could again just use this hand to hold the tubes and with friction just clean the side away from the incision, clean horizontally and vertically with friction. And then you could just dispose of this. And then once you do that, you could take your thermoderm film, and then with both hands you just remove the back of the film and dispose of that, and then just cover the site. At this point the site is covered. You have to wait for the chlorophyll to completely dry up before you put on the derm film. But once it usually takes like 2 minutes to dry up, but once it's dry and you put on the film, that's it. The site is covered. You could then take off the stickers from the film. Okay, and once you're done with that, you could take a pen and write the date, time, and your initial, and you could take, there should be a sticker on the thermoderm, and then you could just put it on top of the dressing on the side. Make sure you don't cover the central line. Just on the side, make sure you don't put it on the patient's skin. At this point, you could just cover your patient back up. You could ask your patient to remove her mask, or just turn the patient, could turn her head. And then you could go ahead and remove your gloves. You could, before you remove your gloves, you could throw everything away and then remove your gloves. Discard of your gloves, and then at this point you could remove your mask. Discard of your mask, and then you could put the patient all the way down. Put the handrails all the way up. Make sure your patient is at a comfortable position. Provide the call bell for your patient, and then go ahead and wash your hands and document your findings and procedures. And that's it.